over to Professor Pawan Sharma ji for next webinar.
नमस्कार, बहुत बहुत आभार सभी पूर्व वक्ताओं को और हमारे एक्सपर्ट इन ऑडियंसेस को. I would like to communicate my sincere regards and thanks to Dr. Vishnu Prasad Sharma sir. Today's webinar is dedicated to him as he is the senior most expert in Northeast. He knows very well each and every part of Northeast, and maximum of these speakers are students of Dr. Vishnu Prasad Sharma. He is member of NCISM also. He is former principal, Government Ayurvedic College also, and now he is emeritus professor also. I would like to welcome Dr. Dayarisa Rambai, lecturer, Department of Sharir Rachana, NEIAH, Shillong, Meghalaya. I would like to welcome Dr. Aditi Acharya, very dynamic, knowledgeable, fluent speaker from Guwahati. Basically, she is from Tripura. And Dr. Kim John Ling Jolly from Manipur. So today we are celebrating Statehood Day. So happy Statehood Day to all. Though it was 21st, so we are sorry we are late to celebrate it due to our preoccupied webinars. So I would like to welcome all the speakers and now request to celebrate happy Statehood Day for our 3 states, Meghalaya, Tripura and Manipur. Thank you very much for joining within short notice. Thank you very much. I would like to request Professor V.K. Agnihotri sir for his preamble.
Thank you, Professor Pawan Sharma ji. Thank you so much. Really, it's a great pleasure to go for 1238th webinar, which is having a very good topic, a topic of happiness, topic of joy. That is the statehood of Northeast states, especially Tripura, Meghalaya, and Manipur. So it's a happy Statehood Day. We are celebrating a bit late as the last webinar of today's. Really, the great player of Northeast as such is Professor Vishnu Prasad Sharma sir with us. So very naturally, he has been kind enough to arrange the speakers of from these states, and it's a pleasure that a doctor coming from Tripura and studied there in Northeast Institute of Ayurveda and Homeopathy in Shillong, Meghalaya. So in that way, we are having a good combination of the states speakers, and definitely we are having some local activities, traditions, and of course, maybe based on their own language, but the thought will be conveyed to us and the feelings will be received by us. And definitely, they may use a few words in their own language just to give honor and respect to the state languages too. And we are equally thrilled to know all these things from their state, along with their diets, their dresses, their Vedyak Parampara, everything, whatever they are having a specialty and contributing to our country, to your country, because these all states are representing in a form of tableaus there in the Republic Day parade. So all these things are from your side. So we are eager enough to have knowledge from your side. So we again honor, respect, and welcome all the guest speakers of our today's Northeast states to celebrate our this Northeast their Northeast Statehood Day. Thank you so much, and over to Professor Pawan Sharma. Namaskar.
Before inviting Vishnu Prasad sir, I would like to communicate that he is the pillar of IRES AYUSH SAMRIDDHI. Agnihotri sir, Vishnu Prasad sir are the basic pillars, Lakshmikant Dwivedi ji, Nishant Shukla ji, but Agnihotri sir and Vishnu Prasad ji are kind enough to spare his valuable time daily without fail. Really grateful, sir. We are grateful to you for this journey. for this year. Thank you. Thank you, sir. So now I would like to request Professor Vishnu Prasad Sharma ji for his valuable address.
Okay, thank you. Namaskar, Hariom. Good
Hari Om.
evening to everybody. Today we have very important subject regarding scope of IUS in northeastern region. Yes, very important subject. But in northeastern region, we have only Ayurvedic college and homeopathic college. One Ayurvedic college at Assam, one Ayurvedic college at Shillong. But within short period, two new colleges will be comes at Assam, and one college will be at Pasighat at Arunachal Pradesh, Arunachal. So regarding scope is a very good scope because northeastern region is the full of forest. All Manipur, Meghalaya, Nagaland, Assam, full of forest. It is a hot spot. So what type of herbs is required to do research? Yes, it is freely available. And people keep themselves nearer to the nature. For example, yes, I told already that regarding diabetes, we develop elephant apple. Elephant apple, it shows very good result in the management of diabetes mellitus. Nowadays, in the market, elephant apple will come as a biscuit, as a granules, everything, everything. Within short period, they along with NIPAR, they help in this preparing these things. They collect the research work from me and they develop this thing within short period in the market. It will be available as a biscuit and as a granules, as a granules. And regarding in this area, we have this bronchial asthma is also more common. And for that, we have Albizia libec in the tea garden that tree is available. So Albizia libec, you people know that if we consume as a tea, it's a very good drug for bronchial asthma and respiratory disorder. And for that, regarding in so many diseases, we have a very good plants are available in the northeastern region. So today time is short. I will not explain too much. Other speakers are there. They will explain. So thank you, Pavan Sharma ji and Agnihotri ji, regarding keep the scope regarding the scope of IUS in northeastern region. But others, Unani, others are not available, Siddha are not available. Only homeopath and Ayurveda has more scope and more stress. People like Ayurveda only, whole northeastern region. And our doctor give more service to the people. So thank you, Namaskar, over to Pavanji.
Thank you, sir. Thank you very much for your excellent inauguration. Excellent inauguration, sir. Now I would like to Rimbai. Rimbai is joined. Hello. Hello. Dr. Diarisia P. Rembai. Whether you have joined, madam? Aditi Vishnu Prasad, sir, please guide. Otherwise, I would like to request Dr. Aditi Acharya for his valuable presentation.
Let me see.
Yes.
She has joined. I think she has joined. Hello.
Please.
Pavan sir.
Yes,
प्रणाम
please.
सर.
प्रणाम
सर. सर वो मैंने आपको स्लाइड भेजा तो प्लीज आप अगर स्टार्ट कर देते हैं. सर पवन सर को भेजा है मैंने.
Yes, you can continue, Aditya. Are slides visible?
जी sir, जी sir.
Hari Om. All the best.
Okay. Good evening, everyone. Okay. Good evening, everyone. Myself, Dr. Aditya Acharya, presently studying in Government Ayurvedic College, Assam, and I have been passed out from Northeast Institute of Ayurveda and Homeopathy. So, luckily, the two colleges of Ayurveda in Northeast, I was very lucky enough to be part of both of them. My UG from Shillong and my PG from Assam. So today I'm going to present uh, a little presentation on Northeast medical plants. So there are two main plants about which I will like to speak, and so that everyone can know about it. So next slide, please. The first is the black turmeric. This is specially found in Shillong, and it has a marvelous action in specifically antibacterial and anti-inflammatory action. So next slide, please. So yeah, so you can see here. So the distribution of plant is specifically in the northeastern region and in the Bengal space region. So the climate and soil, because here, as in Ayurveda, it is said that this northeast region comes under the Anup Pradesh. So here it is having a favorable place to grow. Whether in other place of India, it is very rarely to know about black turmeric. So next, please. So the family is the same, gingiberis. Then Ayurvedic name is Nark Achur. So in our classic also we have mentioned about this plant. And in Unani it is known as Siya Haldi or Kali Haldi. And Hindi it is known as Kali Haldi. And trade name is Black Geodori or Kali Haldi. So the part we use is the rhizome. So next, please. So the therapeutic use of this is, it is antibacterial, as I said, having antifungal properties, and it is also laxative. And because I have seen it personally when I was in Shillong, uh, there were the farmers, a few farmers only, they used to harvest it because it has been not recognized widely by the people of India that it is having a high properties of antibacterial and anti-inflammatory action. That's why it is unexplored. So if anyone who is interested in this medicine is kindly asked to explore it more, because I was searching some so that I can get some research paper on it, but rarely I didn't get any research paper, like a valid research paper, as it is used as a tonic for brain and heart, and the rhizomes are useful in treating leukoderma, piles, bronchitis, asthma, tumors, tuberculosis glands of the neck, enlargement of the spleen, epileptic seizures, inflammation, and allergic eruption. As I have said, it is having anti-inflammatory action. That's why mostly used in inflammatory conditions. The next drug which I would like to highlight is Hedychium spicatum, a ginger species. It is also unexplored. Only one journal I have found, and in 2027, Times of Hindustan, Times of India has highlighted this species of ginger. It is found in Nagaland. The specific thing about it is it grows on tall trees. So this species is used in medicine, food, cosmetic, and perfume industries traditionally by the local peoples. This is also unexplored, and it is also as having anti-inflammatory properties. It is used in inflammation, pain, asthma, foul breath, vomiting, diarrhea, bronchitis, hiccup, and blood diseases. So next, please. So this is a morphological this picture of this plant. So next, please. Here you can see it is growing over the trees. So this is from the Hindus time, that two new ginger species found in the northeast. Hedychium cinnamonum was located in Nagaland, while Calu camphimera was found in Manipur. So this one article I found through which I go through explored, because I have not seen this species personally. So by highlighting these two species, I would to request all the honorable, respected people sitting here or seeing this webinar to kindly explore more such drugs in Northeast, because Northeast, as Vishnu sir said, that it's full of forest. It's a hotspot of Ayurvedic drugs or miracle drugs. So it's a request by this showing these two drugs that there are many drugs to be explored in Northeast, so that we can have a good things from Northeast contributing in our health system. Thank you so much, sir.
Thank you. Thank you. And according to our topic, I would like to ask few questions. What you feel the scope of AYUSH in your state, Tripura? Number one. Number second, whether Indian students can study there. Number two. Number three, whether you means what you are observing that your graduates and postgraduates are working in rest of India, or they are really preferring to work in Northeast. These are my.
So very good questions. Actually, this is the like
Your
mind-blowing question
observation.
I can ask. A future wala. Sir, first of all, in Tripura, we don't have any Ayurvedic college, sadly. Only one state Ayurvedic hospital is there. So I would like to request the dignitaries sitting here, kindly explore Tripura. It is abundant of scopes. You will find so many good herbs there, but sadly the government is not working towards it. Sadly, like there is, I have not seen even my seniors from Tripura. Mostly they are working outside Tripura. This is the thing. Your answer for the third question. Most of them are not going back to Tripura because there is no job opportunity and there is no scope, even like uh, no homeopathy college also. Like there is no Ayush college in Tripura. This is the thing. So I would like to request the government to please focus there. Yeah,
Private practice.
yes, sir. They are like they are some medical MOs are there, but mostly they are homeopathics and Ayurveda. There are very few because after doing PG, no one want to be go for MO post. This is the thing, and there Ayurveda peoples are taken for CHU post and MO post. So after PG, one have to explore their uh, quality, na, in treating more patient and this. But there in Tripura, sadly there is very less scope. What I have seen is a very depressing thing. I hope it will
like
be
Bengal,
good in
like
future.
Bengal. No, like Bengal, because your language is also similar to Bengali. So like Bengal, whether homeopathy is more dominant than Ayurveda, or what is there? In
Yes, the
Bengal,
same.
homeopathy is there.
Yes, the same. In Tripura also, homeopathy is more dominant than Ayurveda.
Excellent. Excellent. Agnihotri.
Thank you, Professor Parameshwaraji, and thank you, Dr. Aditi. It reminds me one more thing. How many medical colleges are there? MBBS colleges are there in Tripura?
There are two MBBS colleges.
Two MBBS. And what's the
Yes, sir.
population of Tripura?
So population is approximately I can say it will be around 20 to 30 lakhs like that. No,
20. And this
actually I
Ayurvedic,
don't know, sir. So I will not
no
say it
problem,
like
approximate. So your
approximate,
Ayurvedic
sir.
hospital, your Ayurvedic hospital is of indoor facility also or a simple OPD?
Sir, it is having indoor facilities, but it's always vacant, sadly.
So that Ayurvedic hospital is being governed by which of the officer?
Sir, I don't know that. Actually, sir,
Because that is
I
the
have visited
I am
only
asking
twice
these
there.
things because this is the track we can approach for the Ayurvedic college. The
Yes,
officer
sir.
on
I will get the information and I will text you personally because I really don't
he
know
can
much.
42.23
motivate.
lakhs, sir. 42.23 lakhs.
Right.
And
So for
Bhopal has approximately similar or more 10-20 lakhs more and having 19 Ayurvedic college.
exactly, I was just talking with Dr. Aditi. In that
So
it
that,
can be
that's
approached.
why, sir, I'm telling you, sir, when I was in North India and Madhya Pradesh, my father was posted in Pachmadi. I got
Yeah.
full exposure of Ayurveda. That's why in
That's
me,
what
I
I was
choose
telling.
Ayurveda above homeopathy. But
Exactly. No, you
sadly,
are
in my state, I
you are
can't say that
postgraduate.
growth.
You are postgraduate, and if you are interested to be there and can hold the torch, become as a torch bearer, because some
Surely,
MLAs
sir,
or some
it will
MP,
be
no,
like
just a minute, some MLA, some MP can approach for the Ayurvedic system of medicine, because this is the right time. At national level, these are being appreciated and say uh, giving some flow to increase up to WHO and Jamnagar. So this is a high time when a few local bodies or authorities, the means the medical officer or the regional Ayurvedic officer, which is known as the DO, he can be approached for the advancement and development of Ayurvedic college dispensaries, and then Ayurvedic teaching and all that.
That will be done by ministries or how a student can be.
Exactly. In ministry, one approach demand from the local public population side, 10,000 signatures or so, something. We have to have some sort of
In the last, we would like to have opinion of Sharmaji because he
yes,
is
sir.
more senior. He can only reply this, but
Yes.
I would like to request Dr. Kim Jong Ling. Kim Jong Ling, madam, welcome.
From Shillong also she joined.
She has joined.
Mumbai. Yes, yes.
Name is not written.
No, she Kim Jong Ring Jolly.
She
Okay.
is from Manipur.
Yeah,
Yes.
yeah.
And one from
Am I audible?
Yeah.
Okay,
Kim
okay.
Jong Non Jolly.
Yeah,
Okay.
yeah. Sir, yeah, you can address me as Jolly. That's sufficient.
Okay, you can on your video also.
From
Um,
Shillong also next time invite that
She is not
Shillong.
prepared and present, so
okay, okay.
she can express her sentiment without video. Please.
Okay, okay.
Okay, okay. Um, respected sir, Professor VK Agnitori, and then my most valuable sir, Dr. Vishnu Prasad Sharma, and other dignitaries, other colleagues, and other some seniors, juniors I have seen here. So I'm very much delighted to be here in this platform. But on the other hand, I'm very sorry that I could not prepare within this short period of time, as Dr. Sir BP Sharma sir has just approached me in the evening. Just he told me that you have to tell something about Manipur. That's all. So when I got the invitation, I just saw the advertisement that the topic is like the scope of IOS in the Northeast. So from my side, since I'm not prepared, where I would just like to add just a few points. As we all know, Manipur is a part of Northeast state, currently having 16 districts, and Imphal as the capital of Manipur. But I'm here currently in Churachandpur district, around 50 kilometers away from the Imphal. Uh, I passed out my BAMS and MD Kaya Chikitsa in Government Ayurvedic College, Guwahati, under Professor Sir Vishnu Prasad Sharma. So regarding the scope of IU, so to say here, of course, in the Imphal Valley, in the Imphal East District, the scope of IUS has been practicing, where I could say there is a 50-bedded IUS hospital located in Imphal, the capital. And then there, as well as the homeopathy, Unani, Siddha, most of the OPDs were functioning. So I'm very sorry that I have not visited there personally so far. Some of my seniors and colleagues are working there. And here in my in my district, in Churachandpur district, there has been some inauguration is going on for 50-bedded IUS hospital at Mulvai Pay, here in Churachandpur district. But due to the ongoing ethnic violence in Manipur, hope everyone knows, violence between the ethnicity crisis between the Kuki and the Meitei. So there has been already like some kind of buffer zone that where the Meitei cannot go to the valleys, and where we the tribal, so to say, the Kuki people cannot go to the valley, that is the Imphal district. So the development for this 50 bedded here in my district is currently pending. So if as of now nothing progress is going on. So regarding the scope of practicing here, if we say in Manipur, yeah, it's really going well, so to say. But one very sad thing is that, like the homeopathy, it's more rising and it's more prevalent, so to say. So this is one of the sad thing, I should say.
Your
Thank you.
voice
Thank
is
you so much.
stopped.
Yeah, hello.
Yes, yes. Voice is coming.
Okay.
We would like to ask you same questions.
Yeah, yes, sir.
Whether Indian doctors are working there or your doctors are. No, you have college there in Manipur?
Yeah, sir. In some private nursing home, they are recruiting the Ayurvedic doctor or the homeopathy as a resident doctors. That is the, one of the most commonest posts which they are working. And then some of my colleagues, seniors, juniors, somewhere they are opening their own clinics, so to say. So, and the scope of job, we can say, sir, there is NRHM, which recruit both the, MBBS, and the IUS post. Here, currently, they are getting the same pay as of now. So, from my point of view, from, I think, yeah, that is the, most prevalent one, that they are doing their job in their own ways.
Thank you very much.
Pawanji, Shillong lady, she is waiting. She could not join. Please, please send the link again.
No, she has joined, I hope. DIA. Madam, have you joined? Welcome. Please ask Dr. Sharma, sir. She has joined. Hello.
Kiran, Daya India. DAIA.
Dr. Vishnu Prasad Sharma, sir.
हाँ.
उन पे जो मेरे पे वो नंबर है, वो व्हाट्सएप नंबर नहीं है उनका. ये अभी जो ज्वाइन हुए हैं वो कौन है? एक बार नाम लेके पुकारिए.
Daya.
नहीं सर नाम जानते हैं.
Hello, Rimbai. Hello. Hello.
आपकी आवाज आ रही है? आपकी आवाज आ रही है?
Hello, Rimbai. Hello.
No, Rimbai has not joined. Dalla India has joined.
Daya India. Yes, meeting group chat. I am on mute, sir. You can unmute, please.
Unmute.
Please unmute.
Yes, you are in list.
Please unmute, madam. You can unmute.
On mute, you click, automatically it will be unmute.
सर लीव होके फिर से ज्वाइन होने के लिए बोलिए, शायद तब हो जाएगा.
जी. अभी अपन के साथ में डॉक्टर रंजीत जिनेरो पटेल.
ये स्पीकर बाकी है, वो स्पीकर है अपनी.
अच्छा, स्पीकर से.
हाँ, शिलोंग से जुड़िए, स्पीकर है अपनी तो.
Hello, can you hear my voice? Hello.
Participant not being allowed to unmute themselves.
Being allowed to unmute themselves.
No, it is not. I am requesting him. नहीं, अपने यहाँ तो ऐसा सिस्टम नहीं है सर. एक बार रीजॉइन होने. एक बार रीजॉइन होने को बोलिए ना।
हाँ,
उनको
एक
शायद
बार रिम्बाई, please join again.
Now I'm
Rejoin.
able to.
Yes,
Am I audible?
yes,
Yes, yes, yes. Very nice, very nice, very nice.
Welcome, welcome, madam.
Good evening, sir.
Good evening. Good evening.
Please start करिए. Okay.
Greetings to everyone who is logged in at this odd hour of the night. So I'm thankful to Dr. Bishnu Prasad Sharma sir for giving me this opportunity to give a talk on, even though it's late hour at night. So I'm from Shillong, Meghalaya. So we recently celebrated the 52nd Statehood Day of Meghalaya. So this is the 52nd Statehood Day of Meghalaya, which we are celebrating along with Tripura and Manipur after getting an independent state 52 years back on 21st January 1972. So not taking much of your time, since I belong to Ayurvedic field, I'd like to highlight a few of the medicinal plants that is available in our state and also the practical difficulties which we are facing in my state. So before getting into that, as we all know, we have been widely recognized by the Panchakarma, which has been famous worldwide. So whenever people talk about Ayurveda, they always say, they always correlate it with Panchakarma. But talking about the practical difficulty which we are facing here in Shillong, especially right now where I'm staying and practicing. So this is Meghalaya. So we receive a lot of. Am I audible?
Yes. Yes.
Yeah. So we receive a lot of rainfall. So you never know when the rain comes. So there's a climatic changes abruptly. So we suppose now we tell a patient, we have to advise you for nasya therapy for given any conditions. Can it be headache? It can be sinusitis or anything. So there is the cloud changes and then sometimes it rains, and as we all know, since being from this field, that we are not supposed to advise nasya in such a case. So sometimes the patient, you tell the patient, can you please come the next time when when it's bright sunny day. So they'll come. But what if the day when day comes and suddenly it starts raining? So you can tell the patient, you can postpone the treatment once or twice, but how many times can a patient cooperate? So these are some of the practical difficulty which we are facing here. And the other practical difficulty is the panchakarma therapy, like Vamana, Virechana, Basti. These are very new procedures for people out here. It has not been as widely exposed as compared if we talk about down south there, like Kerala or Bangalore or Karnataka or even Maharashtra, for a matter of fact. So here, convincing the patients to undergo such therapies is also a problem for us because they have not been exposed to such a treatment protocol, so to say. So getting the consent for them, because we cannot perform the procedure without their consent, and administering to obtain that treatment, we have to administer sneha. So here also, again, that is another practical difficulty where we don't have the habit of including or ghrita in our daily diet, right? So these are some of the difficulties which we are facing in OPD basis and IPD basis. But there are some good thing also which I can tell you, which we get in our state. For example, it has a lot of medicinal plants which are widely grown here. So some of them I'll take into consideration. The local name is Jayur, which is Xanthoxylum cassianum, the variety, which has an analgesic effect. So here we can see that whenever there's a toothache of a child or something, so they crush the drug and then they'll apply on that area or on that tooth, the decayed part of the tooth, which is having an analgesic effect. So this plant, which looks like a maricha or a pepper, it is widely grown here, and also in folklore practices, we have seen that people are practicing it. And the other drug which we see here is Haridra or Curcuma longa, which is, as we all know, which is having its antioxidant property and also anti-inflammatory or anti-allergic, antiseptic, all these properties which is seen in this drug. This is also widely cultivated by the people here. And another drug, amlaki. If you go and visit different places, you get amlaki, which is a very important drug in Ayurveda, because we all know that it belongs to Triphala. So it is widely used in rejuvenating therapy. Also, it is mentioned that it is used for rasayana, for longevity or for it acts as a rejuvenation, which due to its rich source of its benefits, like we can see. And also it is also a very rich source of vitamin C, which is good for hair, skin, like so. So we can see its widely distribution in our area here. We can get especially the variety of the smaller variety, not the bigger one, not the cultivated one, the one which is naturally grown. And other drugs like Trikatu, Pippali, there is Kurma, Piper longum, then Maricha, Piper nigrum. All these which are having property for constipation or for any obesity, indigestion, these drugs are also widely grown, and we get these along with the here people. They take a lot of areca nut along with the betel leaf. So along with that, we get all these maricha or Piper nigrum. So these are few of the drugs which are available here, and also the ing we call shunti, the gingiber officinalis, which is called as ing makhir or ing tro in the local language here. This also is widely grown here, and we also see it is mentioned also it is used as an expectorant in case of cough, and we see in any household in the daily practices also, whenever there's a cough of the child and all, there's a practice of the uh, locals here of including them in the or using it as a medicine purpose in treatment of the child or an adult, for that matter of fact. But even though having mentioned all these good things that we get it here, there is also some lacuna. For example, the availability is there, but it's not meeting up to the certain required amount, which is required by the demand is not able to meet. We are not able to meet the demands as how much we have to produce. So an awareness, I believe, should be created in order for the local people to know the medicinal properties of all these drugs, so that they can be grown in a wide area, and maybe for more medicinal purposes, so that we don't have to. I mean, we can produce all these drugs on our own, and we can use, because the potency of this drugs, I believe, in this place is much higher. So yeah. So these are just a few highlights which I want to say for this meeting. Yeah, thank you.
Thank you very much. Thank you. God bless you. Really, we have troubled you in late night. Sorry for that.
That's
but
okay.
This is convenient time also for all that, because everybody is in the house. Agneotri.
Okay, thank you.
Yes.
Really, Dr. Daya, you yourself proved that you are a very learned person, and you are committed. Your zeal is there to talk and to present your knowledge and be associated with us at about 11 a.m. This is really a contribution from our side, and as you are told that you are having a good knowledge, and you are posted there in Shillong. You are working
Yes,
in
sir.
a government.
Yes, sir. I'm working here at Northeastern
Yeah.
Institute of Ayurveda and Homeopathy.
We are working in Udupi?
No.
Belong
Shillong itself, sir.
Shillong, yeah. Okay. That in the same institute where Professor Vijay Dwivedi is there.
Yes, sir. Yes.
I just visited last year in CME, Sastrabhat.
Oh, I
Yes.
joined last year, December, sir. So
And that was there in early months. Okay, so it's wonderful. The act is also very dynamic, and I think they are developing a lot in a very fast manner. And your local vegetation, flora and fauna is very much there. And you talked about so many good things. And Professor Lachukant Dwivedi also shared a few things there in chat box that Shetty Kachur is there, which is very much used, I think, in Harityakadi churn, and which is one of the Shetty is also one of the ingredient of Chavan Prash. He wrote in this chat box also. And that Krishnadi churn is also there, where Shetty is used, which is also known as Gand Palashi or Kapur Kachri, which is very much effective in the Shukra Dosh Nivarana. So definitely, Meghalaya as such is a very rich as far as the vegetation is concerned, especially our Ayurvedic system. So your contribution will always be there. Depend. Is there PG started or not? First question.
PG, sir? No,
Yeah.
not yet, sir.
Not yet.
Not yet. Yes.
Second batch is out. 2 batches are out, I think.
2 batches are out, sir.
You
It
are,
started in 2016.
Yeah. Okay, I think a great future is there in Shillong and Meghalaya also. And you rightly told that being a Cherrapunji being a second means rich place for raining, of course. So in that way, it is always likelihood to postpone the treatment schedule for as far as the part of this Panchkarma. So that is a tough time to maintain the protocol. But you narrated very well. I really appreciate that you took some pains to join, but when you joined, you narrated all these things very good. So thank you so much. God bless you, and you please keep it on and on. Thank you.
Yeah, thank you so much, sir. Good night.
Good night. Over to Professor Sharma. Yeah, Professor Vishnu Sharma sir. आप कुछ कहेंगे?
प्लीज आप ही बोलिए, बस हो गया है.
अच्छा अच्छा. Is there one more? Is there any guest speaker also?
किरण जी कुछ बोलेंगे? किरण जी.
सर रंजीत सर है. हेलो.
हाँ, रंजीत सिंह also. आप भी देख पाए.
हाँ सर.
हाँ, वो द्रव्यगुण डिपार्टमेंट से है सर, हमारे कलीग ही है. वो कुछ अगर रोशनी डालना चाहते हैं तो वेलकम सर.
वेलकम.
जी जी जी.
हाँ सर, ये अभी भी जो स्पीसीज अभी इन्होंने बोली नॉर्थ ईस्ट के, इनकी बस हमें इंफॉर्मेशन है, लेकिन इसके ऊपर ज्यादा रिसर्च जैसे दोनों मैडम ने बोला कि हुआ नहीं है. इसके ऊपर और भी थोड़ा सा रिसर्च होनी चाहिए. एक्चुअली एक दिक्कत ये भी है कि वो स्पीशीज यहाँ पे अवेलेबल नहीं होती, या प्रैक्टिकली स्टूडेंट्स को वहां जाके ये एक्सपेंसिव हो जाता है. तो नॉर्थ ईस्ट इंस्टीट्यूट है, वहीं पे इनका कुछ अच्छी तरह से फ्लोरा बना के वो प्रोवाइड करके हमें दे, तो इन फ्यूचर हम भी यहाँ पे ऐसे कुछ कल्टीवेट करके या उसके ऊपर रिसर्च कर सकेंगे.
बहुत अच्छा, बहुत अच्छी चीज. विष्णु प्रसाद जी.
Thank you, really.
हाँ बस ठीक है. Thank you. All the speaker has delivered their lecture very nicely. Within short notice, they have delivered their lecture. I offer my sincere thanks to all are my students. So thank you, and पवन जी को भी धन्यवाद ज्ञापन करते हूँ. अग्निहोत्री को भी धन्यवाद ज्ञापन करते हूँ नोटिस का सब्जेक्ट रखने का ऊपर. ठीक है. Thank you.
At the same time, I also thank you for your great contribution and association for arranging all these guest speakers, that too providing them a very short time to get ready. And also they narrated good things about their states. And it's good that Tripura, Meghalaya and Manipur, these are the states here. And senior states are having a little bit more developed status. Gradually, other states will also get some sort of development regarding the Ayush or Ayurveda as such. When homeopathy can be developed, other pathies can be developed, then this is the right time when these things can be developed. So with these words, it's already 11, and great intensive hold is there. All the 3 webinars guest speakers say in numbers, much more number, in 6 or more. I appreciate and I really feeling grateful for their contribution. We extend our thanks for their contribution regarding the Ketu Graha and its all merits and demerits affecting over the persons, and at the same time the Marathi contribution regarding the PCOD management and treatment, and again our Northeast States Day has been celebrated with the help of your kind cooperation. So I think
आदरणीय लक्ष्मीकांत द्विवेदी सर को आमंत्रित करता हूँ।
जी
आदरणीय लक्ष्मीकांत द्विवेदी।
नमस्कार।
प्रणाम सर, स्वागत।
ये अभी जो चर्चा हो रही थी उसमें काली हल्दी के नाम से जो है वो सटी कचूर है, नर कचूर, और ये च्यवनप्राश में भी है, और हरी तक्यादी चूर्ण में, रूसी का सिनोनिम है कृष्णादि चूर्ण। इसलिए जो लेटिन नाम है वो तो करकुमा जडोरिया, और दूसरा जो इन्होंने बताया वो सठी है, जिसको गंधपलासी या कपूर काचरी बोलते हैं, और वो छर्दी रिपू के नाम से राजस्थान में गोलीबंद के और हॉस्पिटल सप्लाई में है। तो हिडेरियम स्पाइरोकीटम, तो एक तरह से ये दोनों ही औषधियां जो है वहाँ होती है, सोर्स है, ये मान सकते हैं। और ये अच्छा इंफॉर्मेटिव है कि सब उत्पत्ति स्थान जो है वो हिल हाई एल्टीट्यूड में ही होता है इन दोनों का। और ग्रंथिभूते सटी सिद्धम ऐसा करके लिखा है श्रुतुसारी स्थान में 10वें चैप्टर में शुक्र दोष की चिकित्सा में। तो ये वास्तव में इसका घी बना करके हमने प्रयोग भी किया था और ये लाभकारी रहा, परिणाम अच्छा रहा उसका उस तरह से। और जो पहले के 2 वेबिनार वो भी अटेंड किए और उनमें भी अच्छी उत्साहजनक जानकारी मिली, उसके लिए सभी को धन्यवाद। पवन शर्मा सर।
आभार सर, आपका बहुत बहुत आभार।
बहुत आभार।
नींद में कष्ट देते हैं हम जानते हैं, फिर भी आप सहनशील हैं, उदार हैं कि हमें क्षमा करेंगे। जय भोलेनाथ। इन्हीं शब्दों
आजकल भोलेनाथ जी के साथ साथ उनके उपास भी आए हुए हैं। जय सिया राम।
जय
सिया राम जी।
तो कल हम लोग सर यूपी डे और गर्ल चाइल्ड के लिए केवल 2-2 स्पीकर रखेंगे, जिससे ठंडों में जल्दी निपट जाए और हम लोग
अब तो बात फ्री बात हो जाएगी। यूपी डे के लिए आप प्रोफेसर उनको रख लीजिए, अपने एसपी त्रिपाठी जी को, क्योंकि वो गाजियाबाद में ही है और उत्तर प्रदेश से बनारस की पूरी छठा और वैद परंपरा पर अच्छे से बताते। और लोग ज्यादा बिजी होंगे, द्विवेदी शायद वो वाले तो आ नहीं पाएंगे।